Prasad, one of my favorite oncologists on this earth, and I wanted to take the opportunity today and ask him a couple of questions that might be of interest to many of you out there who have cancer, who've had cancer, who know of anyone with cancer. And I would just like to thank him for being here today. Thank you, Dr. Dighe.
Thank you for inviting me.
And I would just like to ask a couple quick questions to the doctor. Primarily, what made you decide to become a doctor?
Well, I did my training. I come from India, and in my family, most of the male members became engineers, except for one of my uncles who was a physician. So when I had a chance, after I graduated from high school, to join medical school, I took it upon, and of course went through the medical school in India.
Okay. And
after I came to USA, I did my internal medicine residency. And at that time, I had no inclination of whether I was going to be an oncologist or a cardiologist. But after I finished my internal medicine training, then I thought that maybe I should see what oncology is all about, because it was at that time a kind of a new field, and newer drugs were coming about, and there was some hope that this is going to be more exciting than in the future. So that's really what made me become a physician and an oncologist.
So what specifically was it that made you determine oncology versus cardiac or versus any of the other fields that I'm not familiar with because I'm not in the field?
Well, I think after you finish internal medicine, you have several options. One is that you can go into practice as an internist, or you can specialize in some other branch of medicine like cardiology or pulmonary medicine or nephrology. And as I mentioned, that oncology was kind of a new field that was kind of evolving, and it was something that interested me at that time.
Okay.
So that's how I joined the oncology program in Chicago.
Wow, that's great. And you mentioned your education. What is the typical course of education that you have to follow to become an oncologist? Is it the same for everyone, or did you have to do something different? Did you go to different... I just am not familiar with the type of courses of education that you must take.
Well, I think once you finish internal medicine residency, then oncology is a 2-year fellowship. So you spend 2 more years, doing oncology, which can be clinical, where you're basically seeing just patients in the clinic. Or if you go to one of the bigger institutions, it can be part clinical and part research, where you're actually doing experiments. It could be experiments on mice. It could be patient-related experiments.
Okay.
But that's usually a 2-year program. And if you want to combine oncology and hematology, which most of the physicians do, then it becomes a 3-year program.
Okay.
So you do 3 years of training, and after you've done the 3 years of training, then you can go out and practice in the field.
Sounds pretty intense. Were you nervous at first?
Well, I should have been more serious, but at that time, of course, being young and kind of, I had a lot of friends when I was in training, so I should have spent more time doing research or working. But it was really a three very good years that I spent in Evanston and Chicago.
Oh wow!
So,
did you have to do a lot of studying of all the different kinds of protocols?
Not really. I think as time has progressed, and I'm sure somebody who's doing fellowship now probably is more involved in different protocols. There's definitely more protocols available in the last 10 years than there was when I was doing my fellowship. And I know for a fact that physicians who are doing fellowship in oncology spend a great deal of time trying to see what protocols are available, trying to get new protocols started for different malignancies. And so there's really more that they are doing now than we did 20 years ago.
Right. I also wanted to ask you what are the pros and cons? What do you like about your job? What don't you like? Obviously, there's the downside, I would assume, is seeing some people that don't get well and unfortunately don't make it, and you do everything you can and they still don't make it. And obviously, I'm assuming that it's worth it when you see people like me, the success stories, but I wanted to get your feedback on what it is that you really like about your job, what you don't like so much.
Well, oncology is very intense because you're not just taking care of a patient, you are basically dealing with the whole family. And yes, I mean, if a patient that you're treating is doing well, I mean, it gives intense pleasure, joy to all of us. But even in patients who have very advanced disease, who we know are not going to survive, in spite of what we want to do, even just keeping the patient comfortable, until the very end, it gives us, gives me at least intense pleasure that at least I'm able to keep the patient comfortable. If the patient is surrounded by, his or her family, loved ones, and is able to pass away peacefully, I think that itself can be an accomplishment.
Definitely. Because
there's so many cancers where you really cannot do much. Patients with advanced lung cancer, those are very advanced breast cancer, cancers of the pancreas, stomach. Chemotherapy can be of help, but most of the time the treatment is very supportive. So.
I remember when I was first diagnosed and you had mentioned to me the type of cancer, the type of protocol that I would need, what phases I would go through, and I think I underestimated the severity of the chemotherapy itself and how disgusting it can be and how horrible it really truly does bring you to the brink of death, doesn't it, to save your life. But I wanted to briefly touch on the emotional side of it a little bit. I guess I would like to mention when I had first found out that I was going to lose my hair, the basics. Everyone who has chemo generally has to go through the physical loss of the lashes, loss of the hair. That's just the small part of the big picture. But for me, since I was in stone denial, that was huge. And I remember crying in your office, going, "Are you sure that I have to have that type of chemo? Can't I have the ones that doesn't make you lose your hair?" You just wouldn't. I'm sorry, I think you're going to have to lose your hair. But I wasn't seeing the big picture, I think, because it was too painful, I think, at that point. But when I did realize that, it was really going to be pretty intense and the aggressive protocol was not just going to be, I can do it by myself, I'm fine, but I did need the aid of my parents in every way. And Dr. Yuen in Stanford was my other oncologist, and it was amazing how every time I went to Stanford, I felt as if there was another something that was going to be added to the protocol, even though maybe they didn't tell me everything in the beginning because it was too overwhelming. But within every drive back, I was in tears for another reason, with another thing. Oh, there's a phase 2. I thought that I didn't have to do phase 2. And then don't forget there's a phase 3, too. So after phase 2, you're going to have to complete all of phase 3. And then when I was done with phase 3, don't forget maintenance phase, because then...
See, of course, in your case, basically you had a disease that with aggressive treatment could potentially be cured. And when we looked at, once we knew what your diagnosis was, we knew that most of the big studies with this particular condition was done in Europe. And they of course had a large series of patients who they had treated, and they had come up with, with a protocol which had worked very well for them. When I looked at the data that was published from the study, I mean, almost all the patients did well. So it obviously made sense to continue using that same protocol, even though it was very long.
Right.
And even it was associated with side effects, because we were using drugs that had, major side effects. But if the treatment was successful in Germany, why not use the same treatment here? And I think it worked very well.
Yeah, it worked very well. That would be definitely a good statement, because now, when I think back on how sick I was, I sometimes almost forget, which thank God, because if I can remember everything that I went through, I don't think that would be healthy.
Well, there are so many malignancies where we know that the treatment outcome can be very good if we treat the patients aggressively from the beginning. And in those patients who have those kind of cancers, it does make sense to give very strong chemotherapy. They do get very sick, but at least you know that majority of them are going to do well at the end.
Right, and I understand that's why they chose the pediatric protocol for me rather than the adult version, because I was at 22, 21, what is it, 21's the cutoff?
You were kind of just at the cutoff point.
Yeah, and they said that the adult version is actually less severe, less aggressive, which surprised me. I didn't realize, I guess it makes sense looking back on it now that children can take a lot more because they can handle it. But I wasn't too thrilled at first hearing that I was going to get the pediatric version. That was not something that I was too thrilled about. But
because you thought you had passed that age.
Exactly. I thought I was an adult.
That's fine.
So much for that. But it was great that I did what you all suggested that I do, even though I didn't want to do any of it at the time. And I wanted to stay in San Diego and continue on with my life and have everything, not be as bad as it was. Because I guess when you hear about cancer, some people think, because they know people who've had it and have had not as aggressive treatments, that it's just a week here that you go, and you can go back to work. I know a lot of people who have cancer and go back to work and function normally, if you will, and can have somewhat of a life still. But I felt as if that wasn't possible with my type of treatment because it was daily chemotherapy.
It was very intense.
And it was constant, so much hospitalizations, and I felt like I lived at St. Joseph's because I did. And then I lived at your clinic on the days when I was off, so excited to not be in the hospital and to be in my own bed at night, and then I was like excited to go in the morning to your clinic every day. The nurses were amazing, I must say. It's another thing I wanted to touch on, just how grateful I was to have the most wonderful, your staff, just phenomenal people.
Yes.
And just so kind-hearted and patient, and I don't know, my family asks a lot of questions and makes a lot of phone calls.
Well, it does take when you talk about the oncology nurses, it does take someone to be it's a special person who can be an oncology nurse because they deal with the patient directly, they are administering chemotherapy. They're basically listening to a lot of the patient's complaints. Like physicians, we physicians, we come and we talk to the patient maybe for a few minutes, but then the nurses kind of deal with the patients on a longer time, and some of them get very personally involved. And I feel that it takes really a special person to be an oncology nurse, and we have been very fortunate that we've had very good nurses in our office.
They were amazing, and I still, to this day, when I go visit them, makes me cry because it's hard to believe that I see them, they're still doing everything and continuing to help other people.
Right.
And I think it's amazing. I didn't expect them to stop here, but I can't believe how amazing they are because between, all the nurses, Dr. Mehdi and Sandra Wells and all the other amazing people, even Dr. Purewal and whoever filled in when you weren't there.
Dr. Bangalore, yes.
Exactly. They were just wonderful. It seemed as if I was a little leery when you weren't there, and I know you couldn't be there every single day, but I expected you to be because I know that, you got to have a life too, but I was hoping that you could be there all the time, and I know you have things to do, but when they filled in, I just felt at ease. It was really nice to have everyone.
That's very nice.
Everyone that knew what they were, everyone knew what was going on. But I guess the other thing that I wanted to briefly touch upon is cancer itself and what you think, I guess, why there's so many different kinds of cancer. Why is there anything that you think people can do to prevent getting cancer? I know if we knew that, we'd be millionaires. But I know that I often sit there and think, for my particular type of cancer, is there anything that I did to cause that? Did I eat bad? Did I environmentally put myself in a situation that caused that, the toxicity level? Did I genetically deserve that? Was I predestined to have that? I don't know what to think. So I guess I wanted to ask your opinion on what you think about all that.
Well, I think that's the big question is why anyone gets cancer. And in majority of the cases, there is no reason that you can foretell that he or she is going to develop cancer.